child abuse and neglect happens. It happens every day, and it's so hard for many people to fathom it, to imagine it, to deal with it.
An act or a failure to act that intentionally, knowingly, or recklessly endangered the life of a child.
The Children's Advocacy Center is receiving at least one referral of suspected child abuse every business day of the year. I think a lot of people really don't believe that it's happening in the communities that they live in, but it's happening all the time, everywhere, and it doesn't discriminate.
It's our most common serious case I see on a day-to-day, week-to-week basis. It crosses all socioeconomic bounds.
As we know, kids and adults hide abuse because they may be ashamed, they may be afraid, and part of that fear is that nobody will believe them.
So I can talk to you a little bit about how things were before.
They would have multiple interviews by children and youth and law enforcement and sometimes the prosecutor's office.
The most important thing that occurs in a disclosure is the first time that they tell. Interviews of vulnerable people were being conducted by law enforcement of varying age, skill, and ability in interviewing young people and vulnerable people.
And it wasn't really a trauma-informed process, and so it could be very traumatic to victims and survivors when they were coming forward. So a lot of children did not want to come forward or continue throughout the entire process.
It was going to take funding, it was going to take training, it was going to take dedication.
Hi, welcome to the Children's Advocacy Center.
One of the big question marks was the how. How would we do this? Steve Brown, who was the CEO at Mount Nittany Health, he initiated a conversation saying, this truly has public health ramifications, and there's a role for Mount Nittany to play in this. We're ready to help. And so that was just a true turning point. We wanted it to be community-based, child-focused, absolutely a multidisciplinary approach. So part of our effort was not creating some of these things. It really was bringing them together.
How's everybody feeling today?
You doing good?
The most important aspect of the CAC for survivors is that there are trained personnel who are compassionate, kind, and understanding.
We have a dog, Oliver, and I have a black cat named Midnight.
That is their first voice of hope.
The Children's Advocacy Center facilitates the multidisciplinary investigative team, and that's composed of individuals from Children and Youth Services, various law enforcement jurisdictions, whether at the local or state level, the district attorney's office, our medical providers, our community and prosecution advocates, our CAC staff, and our mental health partners.
It's about collaborating and coordinating more seamlessly between helping the child heal and recover and protection and prosecution.
With the advent of the CAC, everything's now done in a holistic, coordinated approach. Instead of that child having to maybe repeat their story over and over again, they're dealing with a group of people that are trained specially in child abuse investigation.
We're small but mighty. We have nationally trained forensic interviewers. We have specially trained pediatricians that can do child abuse exams.
With the advocacy supports, the mental health referral supports, the in-house pediatrician and medical exams and medical follow-up care that we're able to provide at our CAC is invaluable to helping that child and family on the journey of healing.
For me, success when you're dealing with child abuse cases is that a child felt heard, that the people they chose to share their story with listened to them, they reacted, and they responded, and then they took steps to make sure that they're protected moving forward.
The individuals who immediately get support and advocacy the way they get at CAC are the individuals who find hope, who find some restoration, who find a way for the inner voice to be positive instead of negative.
For a child, from the time they enter our door and begin to be cared for, I think that road to success is reflective of going from being described as a victim of child abuse on the path to healing and becoming a survivor. This experience does not define their future, even though it has incredibly impacted their past and present.
Children are our most vulnerable population. They're our future.
If you're considering supporting the CAC, and I hope you will, know that it is so vital that you are helping vulnerable, innocent children who have been harmed begin that road to recovery and healing, while increasing the probability that we can hold those people accountable who are perpetrating these harms on our kids in the community.
I would encourage anyone in the community to support the CAC in a gift, large or small. Every single penny makes a difference.
A CAC gives a child a safe place, a sanctuary. We're really there just to support them and help them heal and really just live happy lives.
So we have a real gem in this community with our CAC, and something to be very, very proud of.
It's working. Our mission is working. We're identifying it better as a community and as a multidisciplinary investigative team. We're intervening sooner, and we're actually, able to then start working towards treatment and prevention.
The more awareness that we can get for the Child Advocacy Center, the more kids are not going to go through this.
The work of the CAC makes such a difference every single day in the lives of children and their families. The children who receive services at the CAC are in need of our compassion and our healing and hope. At Mount Nittany Health, we are so proud to support the work of the Children's Advocacy Center. It's one more way that we advance our mission of healthier people, stronger community. I wish everyone would join us in supporting these children.